Sam Seder, Emma Vigeland on the Majority Report. Pleasure to welcome to the program Dr. Rob Davidson. He's a West Michigan emergency physician and executive director of the Committee to Protect Healthcare. I want to just start with this clip from ABC News from Saturday of this past week. This was just in the wake of the passage of this big billionaire benefit bill, which is going to cut nearly $1 trillion out of Medicaid. And because of automatic pay-go rules, very well may cut another $500 billion out of Medicaid over the course of the next 10 years. Medicare over the course of the next 10 years. Here's that clip.
Set to enact the largest cuts to Medicaid in decades, experts are warning that many struggling hospitals in rural communities could close their doors. On Thursday, moments before the Senate passed the bill, Curtis Medical Center in rural Nebraska announced it would be forced to shut down, saying it was in part due to the anticipated changes to Medicaid and cuts in federal funding. Local data shows the next closest urgent care facility that accepts Medicaid is nearly 30 miles away. Joining me now is Tyler Sherman. He's registered.
And that's basically, all you need to know about that. That is a story that we're probably going to hear over and over again. Rob Davidson, what, I can imagine what your reactions are to what we're going to see, but give us a sense of how widespread you think this is going to be in terms both on the provider side, but obviously what it's going to mean to people who are going to lose their health insurance.
Yeah, this is critical. I've been an emergency doctor more than half my life now. For 27 years, I've been working in a rural community in Michigan for 23 of those years. And, Medicaid is about a third to upwards of 40% of our patient population coming into the ER. And so if those folks lose insurance, first, it's cruel to those individuals, right? Because they won't have affordable health care. People still have to come in if they're having chest pain, if they're having a stroke, if they're having signs of appendicitis. They now will just be saddled with huge bills, most of which they won't be able to pay. We just got an email from the CEO of our entire system. This is not some liberal activist out there. This is someone running a massive hospital system in Michigan who said this is going to have ripple effects throughout the entire system, throughout the entire state. Because if those folks come in and have uncompensated care, hospitals have to make that up somewhere, right? So people with insurance, people with Medicare, people with employer insurance are going to be paying more for premiums because we know insurance companies aren't going to eat that cost. So this is devastating. The biggest change in healthcare in 60 years since Medicaid and Medicare came on board.
Can you expand on that? The care piece, the phrase just escapes me. But when they have to come in because the federal government says if you come into an emergency, uncompensated care, federal government says if you come into an emergency room, they have to treat you. What that burden on hospitals that already ERs are just completely swamped here. This is going to make that problem worse exponentially, it appears.
Even right now when we're not having, flu season or any major like RSV and kids season in the winter, we're boarding people for upwards of 24 hours. I just worked a shift the other day and I had someone finally leave having a heart attack after 23 hours in the emergency department to go to the big regional heart center because they didn't have any beds. That problem is going to explode because more people, we're talking people who can't get colonoscopies, can't get mammograms, can't get just routine diabetic care or afford insulin. They're going to come in crisis and they're going to go to the only place they can go. I love EMTALA. EMTALA is the law since 1986 that has said, if you have an emergent condition, you will be seen, you will be cared for. I love it. I'm a bleeding heart and I want to take care of patients and everybody deserves health care. The problem is it still costs something. It still costs to have those people seen and have them admitted and have surgery or whatever else they need. And someone is going to pay that price. It isn't the hospital. It isn't the insurance company. It's those people who, are going to be paying higher premiums. And then in the end, what's going to happen is what they're talking about in Nebraska. Hospitals will just close. People having a heart attack will have to go another 30, 40 minutes up to an hour away, suffering worse consequences. It's really devastating, and we got to keep telling this story because the Republicans own it. They did this, and this is going to have massive effects on everyone.
At this point, we have really only, for the most part, CBO sort of modeling as to how many people are going to lose their health care based upon this. I think there's some other outfits that have done their own versions of this. CBO is saying it could be upwards like 15 million people. I mean, it could be more. It's not going out, it's not happening for another 2 years. In which case, you're going to see a growth of, we have population growth. I mean, who knows what the economy is going to be in that instance. Do we have within the context of your locality or within the Michigan system, do they have a sense of how many patients we're going to lose? I mean, this is just the Medicaid part. No one has really sort of like contemplated the Medicare part yet, because that's an automatic result of the deficit that they're going to run. There are pay-go rules, and I guess it theoretically could be avoided, but I don't see how it would be with this Republican Congress. So are you guys like, how do you plan for this?
I mean, you plan like they're doing in Nebraska. These budgets, they're projecting out, 5 years or so, probably around that, and projecting a loss of all of that revenue when we're talking about small hospitals, critical access hospitals, rural, disproportionate care hospitals in big cities. These are places that depend upon A, Medicaid patients, B, the provider tax that the final bill is reducing. That's a way that hospitals or states raise money from hospitals, get federal matching dollars, and then bring back more money to those hospitals. When all of that is going away, the hospitals have to plan out in what they can provide. Now, maybe your hospital doesn't close down, but maybe they shut down outpatient lab for a period. Maybe they shut down x-ray. Maybe clinics will close. Access to care. And that's not just people with Medicaid, right? Anybody who's in that community. I mean, I work in a place that's an hour to the big regional heart center and stroke center, right? So we see people, we can provide them with emergent care, and then we get them down the road to somewhere that can do more definitive care. But those critical early moments are like saving parts of people's brains, saving parts of their heart, helping them avoid long-term disability. And the Republicans have said, we don't care about that. And the reason we know the pay-go piece where Medicare will likely, lose funding won't be fixed by the current Congress. Most of the opposition to this bill was not from sort of vulnerable Republicans who supposedly didn't want to vote against Medicaid. I mean, Tom Tillis gave the most impassioned speech, and he's not going to run for re-election because he knew it would sink him in the eyes of the GOP. It was the Freedom Caucus. It was these deficit guys that said, this isn't bad enough. You're not cutting enough. You're not killing enough people. So we want it to be worse. They're not going to come to the rescue of Medicare. It's very disheartening as a guy who's been doing this for so long, and I know my colleagues all feel the same way. But we're there now. At the Committee to Protect Healthcare, we got 36,000 docs around the country. We've been speaking out as this thing's been rolling up. We've been having press calls and press conferences in Republican districts. We're making plans to do that for the next 16 months so people understand what they just did to them and their communities, and then they can vote them out accordingly.
There's a two-part challenge here, right? I mean, one is communicate what is about to happen. I mean, not about, but 12 months off, 16 months off, so that people can vote accordingly prior to that time. I imagine we're going to see some hospitals start to pare back over the course of the next 12 months and identifying those, either closures or limiting of services as a function of the impending bill. Because like you say, 5-year plan, if I know I'm going to lose 25% of my revenue 2 years from now, for sure, or 35%, I'm going to make my cutbacks now so I can sort of like smooth that out a little bit. But is there also like anybody talking about the potential, because these cuts are not going to be implemented until 27, 28, of the potential in the 28 election to come back in and reverse these things?
Yeah, I mean, the hope is, right? I mean, the reality is almost nothing can get done because of the filibuster. So it all has to happen through this process, right? You get 50+1,
Right.
and you can get
The
things
reconciliation.
passed. Yeah, reconciliation. And so the reality is, if we can reverse this trend in 26 and have a Republican House in 27, we can limit future damage, right? Because they're not done, right? There's still more money to give to billionaires, and there's still more poor people who you can take away from. That I'm sure they can find ways to do that. But then you have to keep building. I mean, this is a multi-year, multi-election process to then in 28 get the right people in. So starting in 29, and you hate to have to think this way every time, but it's how they think, right? It's how they run, how politicians go. So we all have to kind of adapt. But yeah, in 29, you can get back some of that funding, I suppose. You can do a budget bill that is, will raise taxes on billionaires, which we, of course, should be doing, and will get healthcare for people who need it, which is, frankly, in my opinion, and most of our opinions, everybody. Like, everybody deserves healthcare. So yeah, that's the plan.
I imagine you have colleagues at your hospital whose patients that they see on a regular are Medicaid patients. Like what are they starting to hear, or what are they starting to tell their patients who may not be able to see them in 12 months?
Yeah. I mean, I think those hard conversations are starting to happen. I think as providers, we try to avoid the kind of doomsday and doom and gloom conversations. And even, I mean, talking about coverage at all. I mean, the reality is when we go in a room, we don't look at someone's insurance. You just go, you see them. But when you're making plans for them getting a test or getting admitted or getting a prescription, you have to have the conversations, because even people with health insurance in this country, more than 50% of employer plans are high deductible plans. People making $20 an hour with a $2,500 deductible, they can't afford healthcare either, right? They can certainly afford cancer treatment or major surgery better than if they didn't have insurance, but routine care is still tough. So I think, yeah, those are starting to happen where people, maybe they have to start kind of storing up on certain meds that they won't be able to get, or get some of their tests out of the way sooner rather than later. Don't wait, for down the road. I think those are the tough conversations that we shouldn't have to have, but they put us all in the position of having to do that. I will say I had an OB come down just a few weeks ago as this was all being contemplated. And, for what we have all heard, 40-some% of the deliveries in this country are people on Medicaid. She said, I don't know how we keep an L&D, a labor and delivery unit, open, given that, right? So now what? I mean, is it just going to be home births if you live in a rural area? I mean, okay, sometimes that works out great, but I've seen catastrophic outcomes of home births that haven't gone well in communities that is, a predominant mode of delivery. We don't want to kind of make that our default system in a lot of these places, and they might force us to do that.
Well, I mean, that fits in nicely to like something I would love if you could expand on, is how this is going to affect preventative care. If you're somebody that feels like, hey, I'm not feeling great, I have an issue, but you're in a community where the rural hospital has closed, and in many cases, this is like the only hospital in an hour radius. It also makes it much less likely, one, that yes, if there's an emergency, you could die in the ambulance, but also, if you want to seek out preventative care or see a doctor because you're having an issue, it might be too much of a burden for you, especially if you can't get off work. Like, that's some of the stuff that I'm worried about seeing as well.
Yeah, I mean, again, it's not just the rural hospitals, it's the entire rural health system. So, with the hospital or the outpatient departments, it's, for ours, it's just kitty corner across the parking lot is a multi-specialty clinic with family docs and pediatricians and surgeons and OBs and specialists who come from the big hospital, an hour away and come up and see people for their aftercare. If that all goes away, you have people who aren't going to be managing their diabetes as well as they should, or their blood pressure. Now you have more people having strokes, more people having heart attacks. Again, the ripple effects, it isn't far-fetched to try to envision this dystopian reality. It will happen. sometimes it happens slowly enough, people don't quite recognize the root causes of it. I think that's why organizations like the one I run and others, shows like this, I mean, we have to keep telling people, we have to keep reminding people, like, all of this dysfunction of the system. The Republicans own it now, right? They hung the ACA around the necks of Democrats after they passed that. And it wasn't until years later people realized, okay, imperfect, but man, it's sure made a real difference in a lot of people's lives, particularly expanded Medicaid under the ACA. But affordable insurance, tax subsidies, another thing they didn't address that's going to go away, and another 4 million people lose insurance, and another some 10 odd million are going to have more expensive insurance because of that. I mean,
I wanted to just touch on that in particular, because I think, we hear a lot about the Medicaid. The Medicare stuff is sort of like people, I think, have barely touched upon the cuts to Medicare that are going to end up coming. But there's also, like you say, a massive amount of people who are either going to be losing their health insurance through the ACA exchanges, or be paying $2,000, $3,000, $5,000 more annually because of it. And do we have numbers on that, or what the implications of that are in terms of people, or is that wrapped up in the CBO's 17 million figure?
I think that's in the 17 million, but 4 million of that is considered that ACA piece where people will lose insurance. But another, I've seen numbers around 10 million who will just have more expensive insurance, right? Their premiums will be higher. It's almost, if you devise a bill to screw over the most people possible and make them the least healthy possible, this could be the perfect bill to do that, because of how many aspects of the healthcare system that it completely unravels. The CEO email we got, they said these cuts aren't waste, fraud, and abuse. This is critical, compassionate care. And I almost think we have to keep saying that.
I mean, it seems to me that essentially what is being cut is essentially a repeal of Obamacare, or at very least the ACA part of it, right? Like the expansion of Medicaid, the exchanges, as opposed to the patient protection elements, remain in terms of private insurance. But at the end of the day, when we're talking about, 10 or 12 million or 13 or 14 million people losing Medicaid, that was the ACA expansion. And then, another 4 or 5 million people losing their health insurance on the exchanges. That's almost half of the people on the exchanges, maybe a third of people on the exchanges. But the prices are going up, rendering the granted, not the best of impact. The exchanges didn't do much in terms of making it terribly affordable. It slowed the rate of increase marginally. But it's basically a repeal of the Affordable Care Act, and it was never really communicated that way.
Yeah.
No, it's an end around, right? John McCain with the thumbs down stopped it in its tracks when they tried to do it full.
But that was effective. The Democrats actually were able to stop that then, and they didn't message it the same way this time.
Yeah, we do need to do better, but I think the reality is, I think doctors, patients, hospitals, I think hospital systems need to be brave and communicate to the public what this means to their system and their community, and not worry about like getting called names by Trump. I think doctors need to be brave and stand up and communicate effectively. I was at a shift just about 3 days ago, and we had done a press conference in Lansing, Michigan, in Tom Barrett's district, Michigan 7, swing Republican district, about Medicaid cuts. And I was on the local TV, and a guy came up to me, part of our janitorial staff, who I've known for several years. He said, "Hey, I heard your speech. Thanks so much for doing that. I really appreciate it." And so we can get to people. We can explain this to people. We all need to do it, because frankly, they're not going to trust politicians on either side. At some point, they just throw up their hands and say, it's all politics. They all, they have a certain opinion of all the politicians. Yes, they need to do it, need to do better. But it's really on groups of advocates. And as a physician, I take that responsibility seriously, and we do as an organization. We're going to be there. We need to just keep talking about it and let people know what happened with this bill and what this means to them and their communities.
Do you have a sense of whether heads of these big hospital groups, and I have my issues, I should say, with these big hospital groups. I mean, we are at a very precarious point with the level of concentration we have of hospitals and the sort of contraction of our medical system as it exists already. And this is going to make it that much more precarious. But do you have a sense that there's a certain intimidation factor that their response to this bill was muted because, and I imagine, rural Michigan, I have some awareness of what the politics are going to be like in a rural Michigan area, and they're going to be somewhere, between militia and, a conservative, I think.
We're full on of militia, please. We're there. But yeah, and I actually live in Betsy DeVos's county, right? We live about a half hour from where her biggest mansion is.
Do you think that there's a certain amount of intimidation factor as to how much people were able to speak up and say, this is going to seriously inhibit, obviously they're there for a profit motive, but it's going to seriously inhibit their ability to just sort of like serve X amount of people?
Yeah, I imagine there is, right? I'm not in those rooms. I don't work in the C-suite in the hospital, but in the muted response, that's the only explanation, right? I'm sort of proud, a little bit surprised and proud that the CEO did send out this email to staff, right? This is all staff, letting them know the negative impacts, and very clearly said this isn't a political statement. This is just reality of what this is going to do. And so, they were pretty brave around COVID when people were saying, something about vaccines and how they don't actually help and all that, and we knew that was all BS. They came out and defended, the realities of COVID and the vaccines. I hope they are brave enough to do that, but I mean, we've seen, right, the retribution just in public comments from the Trump administration, but who knows what else they would do, how they could weaponize the government against these big systems. We've seen in the media, right, people paying out to Trump and his cronies, so they can get deals through. I mean, it's a dangerous time because people may put that before, just communicating reality and trying to take care of their communities. But the reality is this is going to be so devastating, they can't just put their head in the sand and ignore it. So I guess we'll see. We'll see what they do next.
One last question, and this may be a little bit, it may be too early to see, but I have to imagine that if I am contemplating the idea of going to medical school, and I'm seeing the assault on student loan programs, and two, I'm seeing the assault on science and coming out of the HHS, and the complete attack on science, on medical treatments, on and then I see, and then I would imagine there's also sort of a separate pressure coming, like that guy who sends out that memo to everybody, they're not looking to hire new doctors right now, I would imagine. Do you have any knowledge of essentially like a dearth of, like, I would imagine we're going to see it from medical schools, that their admissions or applications are going to go down, because I just don't know how somebody says, like, I'm not going to go into this job as a doctor
and put myself into debt.
Maybe I'll be an Instagram influencer and, push beetroot or something. But I'm not going to go be a doctor.
Yeah, I mean, I can speak anecdotally. I'm in my mid 50s. Med school cost me about $70,000, 30 years ago. But I had a colleague who's in his early 30s, still paying off loans, and he brought this up to me. I didn't see the student loan, piece of this because I hadn't focused on it. He said, I come from like a poor family. He said, I would not have gone to medical school if those were my loan options, right? If I was taking on that degree of debt and it was going to saddle me the way this new setup. And I don't have all the details. You've probably spoken about it and you will continue to speak about it, but it does make it prohibitive for people who aren't rich. So you're going to see, rich kids going to med school perhaps, And then the other piece I think we can look to is the impact of state abortion bans on people applying to medical schools and residencies, going to residencies in those states. Factors outside of individual aspirations to be a doctor, to care for patients, impact people's decisions to do that in certain places. Abortion bans, had a decrease in folks in all specialties because they said, I just don't want to be in that place when practicing medicine involves potentially going to jail. And so absolutely, I think we're going to see a chilling effect. And we already have a physician shortage in particularly these rural areas. Yep. I guess their secret is they close the hospital, close the clinic. There's no longer physician shortage because there's nowhere for them to work anyways.
Okay,
but yeah, I think that's another thing.
Just one more question really quickly, Dr. Davidson. When we're talking about how our healthcare system has so consolidated already, and we see these Medicaid cuts that are going to dramatically affect the margins of even the largest conglomerates in the country. Does part of the silence that you're seeing play into the fact that the administration is going to be responsible for any future mergers and overseeing that? And they're worried about, I heard this from somebody that works in corporate America, their biggest competitor, it's like the threat that they're going to be pitted against one another. And if they don't do what Trump says, that's going to be the one that gets selected for X contract. Like, it seems like that could be playing out right now in the medical system in terms of the Medicaid cuts and their impact.
Yeah, I'm sure that's part of it. The other piece is private equity, right? Their deep involvement in medical practices and hospitals. I have a good friend in Philly who just lost his job because his hospital, Crozier and Delco, closed down, and he's now driving 2 hours, working night shifts in other parts of Pennsylvania while he's trying to find a new job. That piece as well, consolidation and private equity. And yeah, those folks certainly stand to benefit from the tax piece of this bill. But obviously want to stay in the favor of the administration or anyone in that administrative state that can kind of decide and determine what they can do next. It's sad that that's part of the calculus of these systems. We'll see when these cuts start coming through and they have to make these financial decisions based on the cuts, if that's a stronger impetus for them to speak out and to try to help push for policies that benefit patients that eventually benefit them. I guess we'll have to see.
Aside from folks individually talking to their neighbors and folks organizing in their localities and looking towards organizations that are pre-existing, and whether it's unions or DSA or I don't know, even local indivisible, or is there specifically any way that folks in Michigan or in general can get involved in what you folks do?
Yeah, at committee2protect.org, really anybody can come on and get involved and support financially, I suppose, but really physicians, healthcare providers, we want you all to join up, to be a part of this movement. So we can, we are all advocates daily for our patients, banging our head against the wall, getting things covered by insurance companies. We have the ability to be advocates in a wider sense and help protect our entire communities. And if you're in any number of these 40 some odd, swing districts that are going to determine the fate of Congress in the next election, we need you to be involved. We need you to speak up, and we can provide the apparatus to be able to do that.
Dr. Rob Davidson, Director of the Committee to Protect Healthcare. We'll put a link to that organization. Thanks so much for your time today. Really appreciate it.
Thank you both.
Hey, folks, don't forget to hit the subscribe button and check out our daily show. We do it every day at 12 p.m. Eastern for about 2.5 hours. We even take phone calls. You should check that out.